Working as a care professional, caring for those with dementia certainly has its rewards. However, this same job can also have its challenges. One significant challenge that we face as professional caregivers when caring for persons with dementia is dealing with agitation and the resulting aggressive behaviors. Let's be honest, none of us come to work expecting to be hit or slapped. None of us want to be scratched or assaulted in any way. We also feel terribly responsible for all of the residents under our care, and we worry should a resident become aggressive towards another resident. So during the course of today's video, we are going to spend some time looking at aggressive behaviors and what we can do as care professionals, actions that we can take today to help eliminate and at least reduce those behaviors within our community.
Well, I think the most common behavior that we're concerned about, obviously, is aggressive or violent behavior. We typically see these in people that maybe have the diagnosis of frontotemporal dementia as versus to regular Alzheimer's, although we see it in both.
Let's talk about some of the changes we might notice when our resident becomes agitated. Some residents pace excessively. They move around a lot. Some residents become very restless, wringing their hands and moving their body about. Other residents become extremely fearful and concerned, high anxiety, very worried. You might notice the resident is perseverating on a particular thought or worrisome concern they may have. You may also notice a change simply in their facial expression. The resident gets a furrow in their brow, they just look very worried, or you may see body language where they just are, you can just tell by looking at them that something is not right. They're feeling very agitated. Now, this agitated behavior can ultimately result in aggressive behavior with some residents.
You know, sometimes when a resident is dealing with feelings that are overwhelming, they may become overexcited, or they may be dealing with an emotion such as fear. They can't simply express how they're feeling, and often they may become aggressive.
You may see a resident's behavior escalate and worsen bit by bit to the point they may feel the necessity to lash out or protect themselves is how they're viewing it. You know, we have to remember something about aggressive behaviors. With many residents, the aggressive behavior, the slapping that we see, the kicking, the biting, the scratching, the lashing out that we may observe is simply that resident's way of trying to communicate to us, to let us know, I can't take this anymore. My frustration point is up to here. And so this is the way they are trying to tell us this. Rare is the resident that is simply mean and aggressive out of simply a desire to make our lives miserable. That is simply not the case. The resident is at the end of his or her rope and feels this is the way that they have to communicate with us.
Aggression can be expressed by a striking, a screaming, a push, or some way this is very offensive to a caregiver or someone who is dealing with them.
Aggression can be the resulting behavior from agitation and concern. Now, let's look at why our residents might become agitated in the first place. You know the dementia basics. This video is really designed for you, the advanced caregiver. So let's explore and talk about some of the reasons we might have aggressive behavior in the first place. I'm going to pause the video for just a moment, and I'd like you to discuss with the people around you watching this video why aggressive behaviors might occur. Now that you've had time to discuss, did you mention any of these? Physical discomfort, was that one of the ones you talked about? Did you mention the fact the resident could be hungry or needs to use the toilet? Did you discuss separation anxiety? Maybe the resident is newly placed within the community. Did you discuss the environment? Perhaps there's something in the environment that is upsetting that resident. It could be too much stimulation. There's too much clutter around that may be upsetting them. How about activities? Maybe the resident simply doesn't like the activities that are going on, or something about that activity is triggering something unpleasant with the resident. Was that something you mentioned as well? Did any of you mention change in staffing or a new roommate? Again, those can be concerns that will escalate agitation. How about medication or illness? Things like a urinary tract infection causing discomfort, or nausea, or even constipation can make a resident feel miserable and thus increasing their agitation. Residents also with tooth problems or arthritis pain, anything that's going to cause pain and discomfort, can escalate that agitation. Oftentimes, persons with dementia simply do not have the capability to communicate this pain and discomfort to us with words. So we see them communicating to us in other ways.
Aggression is typically the result of an emotion that the resident can't control. Lots of things that caregivers do, we need to be a little bit more cautious because they can incite aggression. It could be triggered by an environmental noise, a sudden request that a caregiver may ask of the resident, a task that is too complicated, or even perhaps doing something too fast with the resident. The resident becomes overwhelmed, the resident becomes excited, and may respond in an aggressive way.
We also must keep in mind that some residents will lash out towards us or towards others with no precursor agitation whatsoever. They simply just have a physical reaction to something. It's important to have some background information about our residents regarding aggressive behaviors. We can interview family members and others that have cared for the resident in the past and ask them if there has been a history of any aggressive or assaultive type behaviors.
Well, of course, we do have pre-screening with the family, and we try to go into the home to actually observe the person ourselves. We get the physician's report. And then again, we try to be sure they have the right diagnosis. I mean, do we have a younger person with frontotemporal dementia? If we do, we kind of know what to expect.
It's also important to ask family members what pushes the button of that resident. Let's be honest, all of us as human beings have things in our own lives that we may find particularly annoying or irritating. Well, so does that resident. So if we know what may tend to aggravate that resident, we can help avoid episodes of agitation and aggression. Inquire about pharmacological treatment the resident may have had in the past. Now remember, it is never the desire in any residential community that we use medication as a chemical restraint. We never want to give so much anti-anxiety medication to a resident that they are literally snowed and sitting there in a lethargic state so that they don't have aggressive behaviors. We want to use our good programming to avoid aggressive behaviors. But some residents may also augment or supplement with medication as prescribed by the physician. So you'll want to be aware and understand the use of these medications.
Polypharmacy continues to be an issue, not only the various drugs, but the amount that are administered. Most dementia patients do well on pediatric doses instead of adult doses. I think where we see the biggest problem is if you have somebody with Lewy body dementia and somebody gives them a psychotropic drug that's inappropriate, we get into real trouble. Or the person that has frontotemporal dementia again, that's very violent, using antipsychotic drugs or sedative hypnotics or tranquilizers just don't work. Whereas if you use a low-dose anticonvulsant, such as Depakote, these people are very easy to manage. So getting the right diagnosis and matching it up with the right medicine.
Certain residents respond well to certain calming measures, whether it's a hand massage with some lotion, whether it is a particular type of music, whether it is a change in the environment. For example, you can have a resident that is becoming increasingly agitated or concerned within the community. Take them outside for a walk. It works nearly every time to calm that resident down. So knowing their history understanding what can trigger aggression, and also understanding what helps soothe and calm the resident will be very helpful in planning for care. Follow your facility protocol regarding tracking and monitoring behaviors. As an outstanding care professional, in addition to the care that you directly provide to that resident, you can tell a good caregiver is one that is always watching and observing his or her residents, looking at possible triggers, recording what's happening in the environment prior to the episodes of aggression. What time of day is it? What is the resident involved in as far as activities? Have there been any unusual visitors or people in the environment that may stimulate episodes of aggression?
A lot of times people will call or talk to me and just say the patient's out of control. Well, you know, what time of day was it? You know, what medicines are they on currently? What happened before the behavior started? You know, who were they with? All those kind of things I think can be helpful in problem solving the issue.
Make sure that you're appropriately monitoring your residents to record any antecedents to aggressive behavior. While some acts of aggression may truly come internally from the resident, they simply are going to lash out at us no matter what's going on in the environment. Fact of the matter is, many incidents of aggression with a resident really come about because of the interventions that we're using. Perhaps we're not using the best strategy or technique. So it's important that we look at how we're caring for the residents. Sometimes inadvertently we're thinking that we're doing the right thing for the resident when in actuality we are really stimulating these episodes of aggression. Let's talk about some of the common things that will set a resident off and perhaps induce an aggressive behavior. One of the first things that we want to talk about is our own body space and invading our own personal body territory, so to speak. A particularly vulnerable area is the face. Now, while we may think we are approaching the resident with a very loving gesture, anytime a hand comes to the face, for many people, old or young, it can be of concern. They don't like having their face touched by others. Think about it for a moment how many times you really might approach a resident's face during the course of providing personal care. For example, what about giving a medication? If you're coming with that med cup right at the resident's face, that can cause them to lash out, back off, move away. Think about even if you're just offering a bite of food or a beverage. Also, what about if you notice a resident has a soiled mouth or a dirty face and you may simply have a tissue, a napkin, a washcloth? You're really just trying to provide good hygiene, keep the resident's face clean. Yet what the resident observes is, here is this person coming at me, approaching at my face, and I don't like it. So be aware that the resident's face and their personal body space can be a concern. If you are going to have to approach the resident's face, for many residents, you can explain to them with a brief phrase or two what you're going to do. Harry, I'm going to just wipe off the corner of your mouth here where you have a little bit of breakfast on your cheek. Or, Charlene, I have your medications. I'm going to hold them up to your lips so you can take them easily out of the cup. A quick, brief explanation for some residents can be helpful. Watch out. Don't move too quickly. Again, any hand coming quickly at the face can be upsetting. So if you do have to approach the facial area of your resident, come in slowly. Allow the resident to see what you're going to do. You know, nothing is more valuable than that reassuring look on your face, the smile, the nod, so that the resident doesn't feel that you're coming at them in any form of anger or any threatening way. As we talk about invading physical space and the like, another area of concern with aggressive behavior is the hands. None of us like to have our hands forcibly held down. So we want to be very cautious as we approach the residents providing personal care. Or another time this often happens is when assisting with ambulation. Don't grab the resident's hand in such a manner that the resident feels restricted or forced to go with you. One thing that we always like to remember is to offer our hands in service rather than reach out and grab. So think about if you want the resident to take your hand, extend your hand out, palms up. Palms up are helping hands. Palms down are often viewed as controlling hands. During the course of providing personal care, you may need your resident to be in a particular position. Maybe you need the resident now to sit down in front of their chair, or maybe you need them to roll on their side while in bed. Now we know what we want the resident to do and why it's good for them to do that at this particular moment. However, the resident may perceive this as you acting very aggressively and forcing them into a position. So again, move slowly, repeat, and perhaps repeat again and again what you want the resident to do. Charlie, let's sit down. Charlie, bend your knees. Reassure the resident. Charlie, I have a hold of you now. I'm not going to let you fall while you sit down gently on the chair. Charlie, I have a hold of you. Charlie, bend your knees. Charlie, let's sit down carefully. Again, repeating those very simple phrases to the resident, coaching them in the physical position you want them to be. Use your hands, use your body to mimic. Lower your body down. Charlie, let's sit down in the chair. All of this will help the resident understand what it is you want him or her to do. Again, if the resident absolutely does not want to sit down, even though you may want them to be seated, never force the resident. In addition to this being a violation of their rights, the bottom line is you're going to set up that momentum of escalation. Wait a few minutes. Reattempt having him sit down in just a couple of minutes. It's so nice when a community has a variety of activities for residents to enjoy. Oftentimes, we as caregivers, we're the ones helping to set up those activities. Maybe we've put the table cover over the table, we've arranged the paints or craft supplies. If it's a craft type activity the resident may want to do, we've got everything ready. Now we want our resident to enjoy the activity. While we may have a high level of enthusiasm knowing that that resident's going to have a great time participating with this activity, frankly, painting may not be what that resident wants to do this morning. So again, as we are putting the paintbrush in the resident's hand, guiding them, coaching them, they may frankly just want no part of the doggone craft activity today. And so they are going to be resistive or resentful. Gently allow the resident to become accustomed to the environment. Let them look around and watch other residents enjoying the activity. Then you may want to attempt coaching them to participate in the activity. But to simply walk a resident, sit them down, put a paintbrush in their hand, all of that can simply, for many residents, be overwhelming. So watch their body language. Watch their facial expressions. Listen to what the resident is saying to you regarding their level of desire to participate in that particular activity. Maybe they'll enjoy another activity better. Same thing is true with physical activities. Some residents love morning exercise. There are many residents that enjoy, for example, tossing a ball. For some residents, they don't like the ball toss, and they sit there and here you are throwing this big red ball at their face. It's landing on their chest, it's landing in their lap. They may have trouble catching it. That's simply a frustrating point of time for that resident, and they're not having a bit of fun. So watch your residents' level of participation with activities. Observe. Do they appear to be enjoying the activity? Is this something they usually like to do? Or frankly, is this something that is simply going to, again, raise their level of agitation and possible aggressive behavior? Sometimes there are environmental factors that will increase possibilities for aggression. Lighting is a big factor. Whenever residents cannot discern their environment easily, if there's a lot of glare from frankly too much light and they have a hard time seeing something or making something out, this can increase confusion and thus agitation and aggression. But an environment that is too dark or too dimly lit can be frightening. Think about it yourself. When the lights are out and it's very dark and you may hear an unusual noise or something, don't you notice that you become more frightened simply because of the lack of light? Well, this same thing can be happening with our residents, so we want to make sure that our environment isn't contributing to this aggression. Noise in the environment can be a factor. And noise, sometimes when we talk about noise, we think about clanging pans or loud screeching noises. Well, of course, that's going to be upsetting. But you know, there are noises that we might initially think of as pleasant noises that turn into sources of aggravation for the resident. For example, some residents do not enjoy being in a large group with other residents and a lot of people talk, talk, talk and yak, yak, yakking all at the same time. For them, it's simply overwhelming. While you or I might enjoy some background music playing nearly all the time while we work, for some residents that constant music is again overwhelming and can cause aggression and agitation. Temperature can be a factor as well. If a resident is cold and uncomfortable, again, it's going to increase anxiety. Being too warm can also be a major concern. If you yourself have a lot to do and you're busy and the temperature is too high and you're perspiring, you know how you start to feel, just out of sorts. Well, the same thing is true with our residents, so watch the temperature of the community also. Sometimes it's other residents that actually cause problems. Sometimes it's other residents that will upset another resident. Let's be honest, most every one of us have people in our life, whether it's at work, whether it's at home, whether it is in other social situations that are irritating to us. Well, the same thing can be true within our community. While we enjoy and adore every one of the residents that live within our residential care facility, to be perfectly honest, some residents are not always going to get along perfectly well. There can be something that we're not even aware of that really irritates another resident. So we want to be aware that when residents don't seem to get along well, it's best to try and keep them separated as much as physically possible. Now, it doesn't mean one needs to be put in a room when the other one comes out. No, we don't need to be excessive about it, but encourage them to participate in different activities at different times of the day.
It behooves everybody, when you see somebody starting to escalate, that you take them out of a real busy or, frustrating environment. Try to match them up with somebody that they know and trust, familiar face. Try to redirect their thinking to something, and try to remove them from the current situation they're in to a more calm and serene atmosphere.
Some residents who wander participate in a particular type of wandering called trailing, meaning they trail an individual and they will stick at their heels all day. If one resident goes in the dining room, he's right behind them to sit next to him. If that resident goes in the television room, the other resident's right behind him. If that resident goes down the hallway, here he comes right at his heels. Well, for many residents, it's very disconcerting to have someone following you at all times. So we'll want to make sure that the resident that does trail is diverted into other activities so that they're not, frankly, being a nuisance to a particular resident.
Redirection is the act of engaging a resident toward another activity or something of interest. You can redirect a resident with things that you know are familiar and likable by them. Maybe it's food and ice cream can be offered. Maybe it's looking at something that brings them calmness and comfort, like old photos or a memory book. Other ways of redirecting a resident is simply by walking with them and talking about something reminiscent that they may enjoy to hear.
Simple things are, don't approach the person suddenly. Try to approach them from the front so they see you. Don't use a lot of repetitive words, just simple statements. Attempt to redirect the person by bringing a subject that they love to talk about. Of course, other things like, of course, in the late afternoon, being sure they're hydrated, have proper nourishment, and try to redirect them to a place where they can settle down.
Oftentimes, how we communicate to a resident can affect whether or not we're going to see aggressive behaviors. Never threaten a resident in any way. Never use the phrase, if you don't, Charlie, if you don't put this sweater on, I'm not going to let you go outside. Or if you don't wash your face, you can't come to the dining room. Those are threats, and that's abusive. So simply remove that always from your vocabulary. Never threaten a resident that if they don't do something, something else will result. When we're talking to our residents, or particularly if we're coaching our residents during an activity of daily living, allow the resident time to talk. Any of us feel about this tall if someone is always cutting us off. So you may know what a resident wants. Maybe the resident is trying to tell you they want a drink of water. You know that's what they're going to ask for. Allow them still to say it. Don't cut them off with, yeah, and say things like that. That's very unnerving for the resident. So allow the resident to finish his or her thought. Even if you've heard that thought 10 times before, they deserve the respect to be able to communicate to us and with us. If a resident is worried about something, maybe they're starting to tell you, I'm so worried about my little one, I haven't seen him around today. Don't simply cut the resident off. If you want to use a method of distraction and engage them into a more pleasant topic, great, but never cut them off. Allow them to communicate. Remember, many residents have trouble with aphasia and they have limited language use. So listen to the emotion behind the words, because sometimes the nouns or the verbs they're using really aren't communicating exactly what their desires or needs are. So listen attentively to your resident. Be patient. Allow them to complete their sentences and thoughts. Provide reassurance during this entire period. Never rationalize with a resident. Oftentimes, persons with moderate to advanced dementia simply do not have the ability to process and analyze rationally any longer. And if you're using rationalizations, it can simply anger them. A resident may take cardiac meds. Maybe one of those meds is a diuretic that stops their feet from swelling. If you have a resident with significant dementia, and you are going to stand there and give them a 5-minute lecture on why it's important that they take their diuretics so that they urinate appropriately and pull the excess fluid off and their feet won't swell and they'll avoid congestive heart failure, believe me, you've lost that resident. And all they're hearing is you yakking, which frankly can be very irritating. So instead, attempt to give the med pleasantly. If they refuse, reattempt it in a few minutes. Have another caregiver try and give the med. Use all of your good interventions, but don't simply stand there and rationalize. It can simply be a point of irritation. Avoid asking a resident why they do a particular behavior. If a resident has grabbed out and pinched your skin, to say to that resident, "Why did you pinch me, Charlie?" you're probably not going to get the accurate answer in the first place. And again, why questions can simply increase their anxiety. Why did you do this? Why did you go in the other resident's room? Why are you walking so much? Again, the why questions are simply sources of irritation. Simply use your good dementia interventions, guide them to a different activity, distract them in pleasant conversation, reassuring the resident at all times. Let's review some important points when a resident is aggressive. First, remove other residents from the environment as quickly as possible so there's no chance another resident will be injured. Secondly, scan the immediate environment for anything that could be used as a weapon. Even a dinner plate can turn into a weapon in an aggressive situation. Thirdly, remain calm. Keep your tone of your voice gentle. Provide reassurance. Remind the resident that he is safe and you are there to assist him. Provide helping hands, not controlling hands.
a resident physically embraces the caregiver, the human response is to immediately pull away. It's very natural. But probably the better way is to remain calm and try to speak to the resident looking directly at their eye in a very calm way. If that doesn't work, our next response would be to step back and really begin to pull. Again, that would only incite the resident. What is probably a better way is to try to sit with the resident, talk with the resident, and if that doesn't work and we are really being injured, a quick sudden approach forward could sometimes immediately have the impulse of the resident pull back. For instance, let's say a resident, as we're showering a resident and bending down perhaps in front of the resident glitches onto our hair. The one thing we want to do is go forward very quickly without injuring the resident. That act of surprise, and the human response is usually to step back.
If the resident is reaching out for something and they are aggressive, give them something soft and reassuring to hold on to. Hand them a pillow, or if there's a stuffed animal or something like that nearby that they can squeeze and hold on to, but yet is not going to injure another individual.
It's always important that the caregiver carry their pages and walkie-talkies so that they can be in communication with other caregivers who may be called for assistance in cases of emergency. What's really important to remember, however, is that when other caregivers arrive on the scene, not to surround the resident. The resident may respond in a more agitated behavior. What is probably a better mode is if one other caregiver, using the process or the technique that we call change of face, tries to gain the attention of the resident. That new caregiver should be very calm, should approach the resident, divert them perhaps, and redirect them. The caregiver that they are dealing with originally, who they became enraged with, should step quietly back and remain on the scene.
Distract the resident to a more appropriate activity. Be careful that after the act of aggression has calmed down, that you are not behaving in a negative, standoffish way towards that resident. The resident at this point undoubtedly will still need reassurance and positive attitudes from us.
When aggressive behavior is escalating and becomes out of control or unmanageable, we have to really consider the safety of the resident and the others around them. If in case an unsafe situation arises where the resident may be in danger, another resident may be in danger, or perhaps another caregiver in danger, it's necessary to dial 911.
Although rare in residential care, there may be an occurrence where a resident simply cannot be safely managed within the residential care environment. A resident is becoming increasingly dangerously aggressive, and there is frankly no redirecting the resident. Always summon emergency services. Call 911. Remember, we do not want to see you injured in the course of your work, and we do not want to see other residents injured either. If you notice that a resident is having acts of aggression more often, or maybe you've had a very passive resident that has suddenly started demonstrating aggressive behaviors, notify your supervisor immediately. Service plan changes may be necessary. We want to monitor that resident closely. The resident should have a medical evaluation by their physician to rule out any possible physical causes for this increase or change in level of aggression. It may also be necessary to bring in experts, geriatricians, psychiatric nurse consultants, etc., to help manage the care of this resident. It is never our goal to ask a resident to leave the community or have to evict a resident. However, in rare cases it may be necessary. It is important as care professionals we work with our supervisors, physicians, the resident's family, and others to provide the best possible care in dealing with these aggressive behaviors. Remember, it all starts with you, your observations, your reporting, your making suggestions as to what interventions are best and which ones don't work at all for a particular resident. You are the key to successfully managing that resident within your community.
The good news is that we can manage aggressive behaviors. The way we interact, our approaches, The way we set our environment for our residents is a key point in managing aggressive behaviors.
While there are many potential factors that can contribute to agitation and aggression within our community, always look to the one that you have the greatest control over, and that is you, your actions, your methods of communication, your behavior towards a resident. Examine those. Ask yourself, is there anything that I'm doing that is perhaps contributing to the aggressive behaviors of this resident? And then change those behaviors. Use your positive interventions. Ask your coworkers for suggestions. Talk it over with your supervisor.
Today and in the future, when you're working with your resident, think about prevention. Your smile, your interaction, and your calm approaches is what most likely will thwart any aggressive behaviors.
You are very much appreciated as a professional caregiver. The fact that you have the skills, the expertise, and the knowledge to care for those with dementia is something you should be very proud of. Much success to you as you care for your residents with aggressive behaviors.